Before we start our agenda, yesterday marked National Centenarians Day. I knew I was going to mess that up. Observed each year on September 22nd as a time to honor those who have reached the incredible milestone of 100 years. It's a celebration not only of their longevity, but also of the remarkable contributions they have made to their families, communities, and our shared history. Here in Franklin County, we are proud to recognize and celebrate 7 extraordinary residents who will be joining the ranks of centenarians in 2025. Lucy Owens, Elva Lumet, Harold Hall, Alice Klein, Pleasant Cooper, Mary Yerian, and Mary Lyons. These remarkable individuals are a living testament to resilience, perseverance, and strength, offering valuable lessons from a lifetime of experience and embody the progress and longevity of our society. I pray one day I make it to 100 years. So congratulations to them.
I don't want to make it to 100 years.
Oh, you don't? I do. I want to make it to 104, actually. So don't ask me why, but that's what I want. Okay.
May I have a personal point of privilege?
Yeah, absolutely.
Thank you, Madam President, for a personal point of privilege. I'd like to take a second to just recognize a special guest that I have with me today, and she shadowed me for part of the day. So excited to have State Representative Meredith Lawson-Rowe here with us. If you could just stand up and say hello, wave to the crowd here. She asked one day about what does the county do, what services that we offer and how we operate. And I said, well, why don't you come over and spend the day with us? And she's taken us upon that. And I think that really helps you be a better state representative, because we work very closely with the legislature, and the things that we do, essentially, counties are an extension of state government. We carry out many of the duties that come from the state of Ohio, and we're governed by state of Ohio law. And so I'm so glad that you're taking the time to come spend the day with us. Welcome.
Yeah. It's always good to see you. We were together yesterday. I was a guest lecturer at the Ohio State University Marsha Pitzer Center for Women and Youth, and then you came to conversations with Crowley as well, and so you're shadowing Commissioner Boyce, and so just inspired by you and the work that you do, but always wanting to learn more, always asking the right questions, and so yeah, I'm sure you'll have a fun day today. All right, we have a county administration update. I will pass it over to county administration.
Thank you, President Crawley. Kenneth Wilson, County Administrator. This past Thursday at briefing, Deputy County Administrator Joy Bivens provided an overview of the landscape that we will be facing as a county as a result of recent federal legislation that was approved, and you all asked that we provide that briefing again here in general session, so that the public will be informed as to the impact that's coming up in a very short time in fiscal year 2026. So we want to provide this overview in a brief fashion. So I will now turn it over to Deputy County Administrator Joy Bivens to give a overview of H.R. 1 and its impact on SNAP, Medicaid, and other public assistance programs.
Michael,
Okay.
it's not on the screens.
I can go ahead and just get, okay.
Thank you.
So good morning, and thank you, County Administrator. Thank you, Commissioners. If I could just really quick before I begin, because I know I didn't get a chance to send them a note. I see Josh is here. Josh, this is your last, I think, general session with us before he starts his military assignment. So
Where's Josh? I don't see him.
he's in the back. He's in the back. Yeah, he's leaving us. So I think he's going to be leaving us for almost a year, so you will be missed, and thank you so much for your service. Yeah. Commissioners, as you know, I represented you in Franklin County on the National Association of Counties Health and Human Services Education Steering Committee. I was asked to go to Congress to present to a congressional group on the Ag Committee to talk about SNAP. And I'm so glad we started today talking about SNAP from the Mid-Ohio Food Collective and we need to, as a community and as a country, dispel some myths. So as I go through this, I'm going to talk about two things on a high level, one being SNAP, the other being Medicaid. As you all know, that the HR bill, also known as the Big Beautiful Bill, passed by Congress earlier this summer, included a series of new requirements under SNAP and Medicaid and public assistance across the country. For those of you who do not know, SNAP is the largest federal nutrition program, providing approximately 42 million low-income individuals with monthly grocery benefits. I know, Michael, I'll know where I'm at, and I'll direct you. Just take a look at the screens. I'm sorry. 42 million low individuals with monthly grocery benefits, as well as employment and training. So in order to receive SNAP, you must be working or going to school. I really want to make sure that we dispel the myth. I'm seeing some things on social media with some keyboard warriors stating some things that are untrue. Many folks that are working, that are receiving SNAP, are in that lower earning income, as well as in Franklin County, over 50% of the folks that receive SNAP are seniors and children. So currently, right now in Franklin County, we have about 183,000 folks that receive SNAP. So how does the bill work? As you all know, that Ohio was one of 10 states that receives dollars from the federal government to administer SNAP. So dollars come from the feds down to the state, down to the county, in order for us to administer SNAP, and that goes to our Job and Family Services. Again, Ohio is one of the states that administers SNAPs at the county level. Not all states do it that way, but again, we are one of 10. So in this bill, there are several requirements that they're asking, that are mandating to change. Adults age 18 to 64 and adults with dependents age 14 will now need to complete work requirements. So 14 and over, you will have a work requirement in order to receive SNAP. It was 18 to 54 previously. We have new limits for calculating utilities. There was a utility allowance that we could take into account when administering your SNAP benefits from your gross income to ensure ensure residents receive the highest number of benefits. That has now changed. We are now only allotting that in the case of if you have a disabled resident, family member, or senior in your household. And there are restrictions for non-citizens other than green card holders will no longer qualify for SNAP food assistance. You can change. Again, major changes to SNAP. I talked about previously in the HR bill, our dollars come from the feds down to the state, down to the county in order to administer. So in order to administer SNAP, there is a cost share that the states and the counties take on. So the feds currently take on about 50%. They are now reducing that to 25%. So 75% of that cost share will now be shared by the state. What does that mean for Franklin County? The states will be required to pay a higher percentage of cost. So it is estimated in Franklin County, in order to administer SNAP to the 183,000 folks that we know needed, Franklin County potentially could pay $7.5 million additionally in order to administer that benefit on top of what the commissioners allocate out of the budget, out of the general fund budget for that program to run. What does that mean? That means the commissioners are going to have to make some decisions on things they would essentially need to fund, which means less dollars could potentially go into the community. There's also the change with SNAP where we're going to start sharing, and this is not on here, Michael, I'm going to the error rate. There's an error rate as it relates to SNAP from residents not turning in the proper documentation, not maliciously, but just things get lost. Sometimes you turn in an old pay stub. For residents who are Ubering, their wages fluctuate. And so there are error rates that each county incurs. And so for the error rate, the state now will have to pay for the error rate. And error rates over a certain percentage, I believe it's 9%, will have to pay the feds back for that error rate. The error rate at one point was 9%. I think it's 6% now. We need to keep, or 7% now. We have to keep it at the below the 6%, so we do not have to pay that error rate. If we were to incur that error rate today, based on the 9% error rate, it would be $300 million that this state would have to pay. And Franklin County was sharing that. And so that's not happening, so everyone just, it's okay. We are working hard. The questions were, why do we have error rates? When you have 183,000 folks doing 183,200 billion things, it's easy to make an error from the resident and from the worker. It takes at least a year for a worker to be proficient in processing a case because we're processing from the perspective of understanding policy. We process a case from policy, not this fancy technology that automates for us. So then there's that. We can go to the next slide. And then the next change is to Medicaid. This will be the first time in history that, and many of you are familiar with Medicaid, it's a free, low-cost health care option for low-income residents. A lot of the residents that you see in Franklin County or across the country that leverage Medicaid, they're either working for companies that do not offer health insurance, they're disabled, or they have chronic illnesses that do not allow them to work. And so in this particular, this provision, this will be the first time in history that residents will be required to have work requirements in order to receive Medicaid. And so those folks could, and we have about 409,000 people currently right now in Franklin County that receive Medicaid. So including over 170,000 children. So in our expansion group, we're not only going to be processing Medicaid, but in this provision, the feds are now stating that the change would be administratively, in order to requalify for Medicaid, you have to recertify twice a year, whereas one time a year now. So you sign up, we get you signed up, then you sign up one time a year currently. With this new provision, we now have to touch your case twice a year. We have a lot of transient population, things change, which could cause a lot of errors. So there's a lot of eligibility restrictions. Most non-citizens other than green card holders will no longer qualify for Medicaid. Again, there will be work requirements for homeless children, children aging out of foster care, and veterans. There will be, again, more frequent renewals in order to receive Medicaid. And I want to make mention that with all of these administrative burdens that are going to incur in order to process these cases or to touch these cases, there are no additional administrative dollars to support this work. So the agency that administers both SNAP and Medicaid will now have to look to the commissioners for fiscal support so that we can continue to support our most vulnerable in this community. What does that mean for the community? That means that the commissioners, again, are going to have to look at budgets and figure out the most essential things that they feel that we should fund and the things, unfortunately, that they are unable to fund because there's not unlimited dollars. Next slide, please. So again, that is the most high level. In that hearing, there were conversations on how folks are utilizing their Medicaid card. There is a work group, I believe, that monitors how folks are using their SNAP card from the perspective of buying things that they feel that are not nutritious. And what I said to Congress is people purchase things that they have accessibility to and that they're affordable. We have food deserts currently even here in Franklin County. So a lot of residents utilize their SNAP card so it can stretch. Fruits and vegetables are expensive. Most healthier foods are expensive for residents. But there are a lot of different opinions and different provisions in this bill that we are still navigating. But I will tell you, this is the biggest cut in history that has come to both SNAP and Medicaid, and those cuts impact administrative function for us to be able to do the things we need to be able to do so residents have what they need. But with the commissioner's leadership and support and with the HHS team, we are going to try to look at innovative ways so we can not only increase accessibility, but ensure that there is no resident that gets left behind during these times. A lot of these changes will take place in the year 26 up until the year 28. We are now going across the county, educating the county residents on what is ahead of, what they can do. I sat in on a stakeholder group with Congresswoman Chantel Brown yesterday, as well as our own HHS team, who will be out in the community educating folks on what is happening. We would ask that you please look into the website. We do have some information on there that you could take a look at as these provisions come forward. Thank you, commissioners.
Thank you, Madam President. Thank you, DCA Bivens. A couple of things. One, regarding the SNAP benefits, I think you said 180,000 people receive SNAP benefits. And for the public's context, that would be larger than the city of Dayton, larger than the city of Canton, larger than the city of Youngstown, Springfield, et cetera, you know the cities. So that's a lot of people right here in Franklin County. And then you said something else. We have 409,000 Medicaid residents. That would be, if our Medicaid residents were a city, it'd be the second largest city in Ohio. So given the conversation that we had earlier about food and some of the decisions that we're going to have to make as a commission with regard to the rate that we have to put in, is there any scenario where our residents are in jeopardy of reduced benefits? So in other words, do we just simply have to meet that new threshold? Is that a requirement? Or could it get to the point where if we didn't have those resources, then the state would reduce the amount of people who receive benefits or the benefit that they receive?
The benefit is based on your family size and income. So that's the qualifying indicator on how much you receive. These rates that we have to pay based on errors are just maybe there was an overpayment and those types of things. I don't foresee, based on what the qualifying indicator it would decrease. However, it could be more administrative costs on you, the commissioners, in order to administer, so that these folks can receive those dollars. Because the feds could say you're paying more because of your error rate, so in order to administer, you're going to pay more, and it has to come from somewhere.
And so whatever we have to pay, Madam President, whatever we have to pay is basically set based on that formula. And so so that's tough on our part because that number could go in any
Yes.
direction. But more importantly, residents shouldn't be concerned right now about losing
No.
or getting reduced benefits.
Not at all.
Okay.
Residents should be concerned about, that we did talk about fraud at the congressional hearing, and just like a credit card, there is an EBT card that SNAP residents receive. However, it does not have the same sophistication that a person with a credit card or a debit card had, meaning it does not have a chip. So there was a lot of SNAP skimming that took place, and that can happen at a grocery store. There is no sophistication in order to monitor when someone's SNAP benefits are stolen. So when they're stolen, they're gone. They have to wait until the next month in order to receive those benefits.
Thank you.
Thank you for that update. I would just always encourage our residents to reach out to their representatives, to their members, and advocate for continued support and funding. Yeah.
I do want to make mention for our homeless population, that is changing. So that's what you're going to see. There must be work requirements in order to receive your benefit, and that's going to change starting in 26, I believe. Bart, am I 26 or 27?
For the SNAP residents,
Yeah.
it starts as early as November.
Yeah, and so veterans, the homeless population, you must be working 80 hours per month. And so what that means on us, commissioners, is, as you see, we're going to start infusing the one-door model into high-traffic areas so that we can help more people. But what it's going to cause for us to do is making sure that we're implementing an intensive case management model so that the homeless population can have what they need.